These are things you should avoid if you're hypertensive. The first lifestyle change you should make is limiting your sodium intake. Reduce processed food, sodium-rich food, just anything that has a lot of sodium in it. That's like including like table salt. The second thing you should try to limit if you're hypertensive is smoking. If you smoke, you're harming yourself. Smoking actually damages your blood vessels and increases your blood pressure. The third one is if you drink, if you do alcohol, you should limit to maybe a bottle or two a day. You should try to stop. You should work towards stopping. Alcohol is bad for not just your blood pressure but also your liver. I've mentioned it in my previous video when I talked about liver. Another thing you should avoid is caffeine based products, things that have caffeine. Caffeine is bad for you if you are hypertensive. If you're hypertensive, you may want to exercise regularly or generally do some form of physical activity. This will help in reducing your blood pressure. You may also want to try things that help manage stress. You can do meditation, you can do yoga, deep breathing exercises, just anything that helps you manage stress. If you're stressed, you tend to have like a high blood pressure, so you want to exercise and then manage stress. If you have like dietary restrictions, you shouldn't eat foods that are high in sodium. Like I mentioned earlier, you shouldn't eat foods high in sodium, like your soy sauce, processed foods, packed canned foods, processed meats, sausages, bacon, and the rest. You shouldn't also eat foods that are high in fats, both saturated and trans fats. Full fat dairy products too. Snacks like chips, crackers, should do away with all of that. You shouldn't take high caffeine foods and drinks, energy drinks, dark chocolates, just anything that contains caffeine. Caffeine is really bad for you if you are hypertensive. Avoid NSAIDs. What are NSAIDs? Non-steroidal anti-inflammatory drugs like ibuprofen. Avoid NSAIDs if you are hypertensive. They are bad for you. You should also avoid supplements that directly interact with blood pressure meds. You get more information about this from like your doctor. You should have, speaking about doctors, you should have regular checks. Monitor your blood pressure regularly. Adhere strictly to your treatment regimen. Take your meds. Take your meds when you're supposed to. Attend regular checkups. And avoid all these things I listed earlier. This is how you can effectively manage hypertension. So thank you for tuning in today.